we had a trial for a new device here at Columbia, the Autus valve. This valve will really change the game for kids with congenital heart disease and especially valve disease. The existing technology really isn't suited for pediatric patients. All the valves are built for adults. The alternative is repeated open heart surgeries to replace that valve. What's so awesome and disruptive about the Autus valve technology is that it's put in at one size, and then through cath procedures, the valve could be expanded to larger sizes, but still function. The design of the valve is very thoughtful. When it's implanted at a smaller diameter, the valve leaflets are very tall, and as it expands using the balloon, that will expand the metal frame. The valve leaflets get shorter, but still touch and still work. So it's really mimicking the human venous valve. The implant of the valve is a relatively standard surgical procedure. Thereafter, to get the valve to a bigger size and matching the patient's growth, I would do it in a same-day procedure that would take 1 or 2 hours. And that would be really the substitute for an open heart surgery. I think it's incredibly exciting that this type of research is happening at New-York-Presbyterian. The work that my partners and I are doing here gives patients an alternative and sometimes with clear benefits than an open heart surgery.